A patient received injection atropine sulfate as a pre-medication 30 minutes ago and is now complaining of dry mouth and her pulse rate is higher than before the medication was administered. The nurse buzzed. Option A. The patient is having an allergic reaction to the drug. Option B. Patient needs a higher dose of this drug. Option C. This is normal side effect of atropine sulfate. Option D. The patient is anxious about upcoming surgery. The answer is option C. This is the normal side effect of atropine sulfate. Atropine sulfate is a vagolytic drug that decreases oropharyngeal secretion and increases the heart rate. After a surgery, a patient returns from post-anesthesia care unit with a nasogastric tube in place following a gallbladder surgery. She continues to complain of nausea. Which action should be the nurse take? Option A. Call the physician immediately. Option B. Administer prescribed antiemetic. Option C. Check the patency of nasogastric tube for any obstruction. Option D. Change the patient's position. The answer is option C. Check the patency of nasogastric tube for any obstruction. Nausea is one of the common complaints of patient after receiving general anesthesia, but this complaint could be aggravated by gastric distension, especially in a patient who has undergone abdominal surgery. Insertion of nasogastric tube helps relieve the problem. Check on the patency of nasogastric tube for any obstruction will help the nurse determine the cause of problem and institute the necessary intervention. Valsalva maneuver can result in bradycardia. Which of the following activities will not stimulate Valsalva maneuver? Option A. Use of stool softeners. Option B. enema administration. Option C. Gagging while toothbrushing. Option D. Lifting heavy objects. The answer is option A. Use of stool softeners. Straining or bearing down activities can cause vagal stimulation that leads to bradycardia. Use of stool softeners promote easy bowel evacuation that prevents straining or the Valsalva maneuver. When suctioning mucus from a client's lungs, which nursing action would be least appropriate? The options are: Option A. Lubricate the catheter tip with sterile saline before insertion. Option B. Use sterile technique with a two-gloved approach. Option C. Suction until the client indicate to stop or no longer than 20 seconds. Option D. Hypoxenate the client before and after suctioning. The answer is option C. Suction until the clients indicate to stop or no longer than 20 seconds. When suctioning a client, there is a risk of development of hypoxia. Suctioning sucks not only the secretions but also the gases found in the airways. This can be prevented by suctioning the client for an average time of 5 to 10 seconds and not more than 15 seconds and hyperoxygenating the client before and after the suctioning.